Hi, I'm Dr. Rajani. Thanks for joining me today. I'm talking about my top 3 cat eye procedures. There's so many devices from RF microneedling, fillers, Botox, brow drooping, hooding of the eyes. The angle of the eye plays a role all within that. And what are the best treatments and what's available? A lot of people ask me, hey, I can't find a doc that does it. I can't find a provider that does it. Who's best for me to go to? Do you have a name? What's the best procedure? I'm going to give you my top 3 methods to get a brow lift cat eye look so that it isn't as confusing. And what are the top 3 that I use? My video talking about the cat eye lift with no surgery will be the basis for this, so you can go back and watch that. I'll put links in the description below and also a card at the end you can click on when you're done in this video, because in that one I show someone with a no canthal tilt, so the eye goes straight across, and then one with the cat eye lift, and everyone picks the one that's tilted up a little bit. Not everyone, that would be 100%, but a good 80% of people. It shows you how important the eye is, and eye makeup. How many people flare the edge of the eye to give the cat eye look? How nice would it be to wake up, not makeup? I'm gonna show you my top 3. So if you like the videos, click like, subscribe. Most importantly, share them with your friends. It helps us grow, helps me grow. I'll bring more videos and more in-depth information to you so you pick the right procedure for you. What's number 3? Of course, it has to be Botox. And you can watch my Botox dilemma video. That's going to go through all about that frontalis muscle, the drooping. And the reason it's my number 3 is because it's accessible to people. It's pretty quick to do. You almost don't feel a thing. These are baby needles, no numbings needed, and it's not that expensive. Most people are using 6 to 12 units. This is just for raising at the edge of the brow, and people love it. As we age, it works less and less because there's more hooding, if people have that. There's laxity of the skin. And with neuromodulators like Botox, watch my video, Botox Dirty Little Secret, they don't build collagen. There's no long-term benefit to making your skin better, so you're depending on stopping the downward pull of the muscle that encircles the eye, called the orbicularis oculi. So it's quick, it's simple, it's inexpensive. Just about anyone can get it done. Knowing the anatomy, knowing where to do it, and who should not get it, picking the right candidate, like with everything, is extremely important. Number 2, because it's accessible to just about everyone, people love them, almost everywhere in your town is offering them, are dermal fillers or biostimulators. And for this, you can watch my video on Hollywood's Best Kept Secret. And in there, I talk about filling the temple, and the temple gets hollow, the bone rotates, the eye rotates down, so keeping the eye in an elevated position with filler can be done, and biostimulators such as Sculptra and Plasma Sculpt. So most people have access. The temple is a little bit more dangerous area. Everything's dangerous, first of all. There's vessels in the face, go everywhere. Just because someone knows their anatomy, it's not meaningless. You have to know your vascular anatomy, but it doesn't mean much if you don't have other safety methods in place. How you inject, bolusing or not, moving the needle. We assume, despite knowing anatomy, that there is a vessel everywhere, except less likely deep, but can occur, less likely superficial. Between the layers in the temporalis fascial layers is probably the most dangerous in the body, in the face, other than around the glabella and the nose. So it's right up there. So it's not something that you want to do certainly at home, and you want to see someone that you know has experience doing it and educates all the time, so it keeps everything safe for you. But that being said, injecting the brow, giving brow projection. I do plasma brow, also plasma sculpt, and you watch the video, look 10 years younger. You'll watch we do the brow and the high cheek together. That helps lift the edge of the eye. So fillers and collagen stimulators, biostimulators would be my hands down number 2. Number 3, of course, we've done many videos on them, are barbed PDO sutures. Polydioxanone used in the body commonly in as dissolving sutures in just about any surgery someone might have. They get a form of this, but with little barbs and lifting, and you can use barb or the new molded, but lifting the edge and the vectors. And you can watch my many videos in my clinic, watch the patients, see before and afters, both in my videos and on Instagram about the cat eye, the PDO thread lift, and the fox eye, some people call it as well. But those videos are well watched because it's immediate. You put the thread in, you can come from the hairline or the inferior approach. The hairline gives a little more lift, but people have to keep it clean. Cleanliness is absolutely key. And then you get a lift immediately with the barbs. And here's the best part, long term, because you're building collagen with the PDO suture. And I have slides on my videos of how do the PDO threads work and do they work. And I did one on PDO thread satisfaction. It's about 80% satisfaction on RealSelf. So people love it. They love the results. You have to see a skilled provider, you have to be the right candidate, and you have to have realistic expectations and be willing to repeat it. But over time, it maintains lift because of that collagen production that Botox and neuromodulators do not have. That's my number one. There you go, your top 3 procedures for cat eye. I hope that helps. The comments really help everyone. Tell good or bad your experiences, what you liked, what's lifted your eye, what failed, what did you spend too much money for, because it all helps us educate to keep your skin and body beautiful, healthy, and vibrant.